Welcome to the course in nuclear medicine. Today will be a brief introduction to the concept. We'll look specifically at how nuclear medicine is used to both diagnose and treat patients. Finally, we'll look at the physics of nuclear medicine. How can we use the laws of physics to describe what's going on when we use nuclear medicine? If you enjoy this introduction, please be sure to like and subscribe to the channel. There'll be lots of videos in the future in this lecture series, which I think you'll really enjoy. Anyways, enjoy the video.
Start with what exactly is nuclear medicine. So, nuclear medicine, defined by the Society of Nuclear Medicine and Molecular Imaging. This is a society that kind of governs the nuclear medicine practice in North America. Europe has another society that is called the EANM, the European Association of Nuclear Medicine. These are the two big societies that kind of overview everything that happens in our specialty, but they define nuclear medicine something like this. So it's a medical specialty that it's used to both diagnose and treat disease. So it allows us to gather information that it might require surgery or require more expensive and more invasive diagnostic exams if it was not because of nuclear medicine. And the main advantage, one of the biggest advantages of nuclear medicine is that it can help us identify abnormalities in very early stages of the disease. So even before they even show up from other diagnostic tests, and what is typically thought is, well, if we're able to detect a disease in a very, very early stage, then the chances of having a better prognosis, the chances of getting that patient cured, the chances of having a better health for the patient, the chance of curing the patient is higher. So that's very good. So it uses radioactivity, and we'll start learning about those things in a moment. But when did we start using radioactivity? And everything started back in the days, probably like early in the 1900s, of something called competitive binding assays. So in these competitive binding assays, no radioactivity is injected into the patient. So no radioactivity goes into the patient. Instead, there's a sample taken out from the patient. So for example, a blood sample. This is mixed with the radioactive substance. And then, for example, the idea, let's talk about one of these examples. So for example, measuring thyroid hormone. We wanted to measure if a patient has too much thyroid hormone or not enough. So we would measure this radioactivity, hoping that some of it will combine with that thyroid hormone, will bind to that thyroid hormone. Then the chemical compounds are separated. You watch the radioactivity and you try to just stay with the blood. So everything that stays there, you can count it with some equipment, measure the radioactivity, and then you can find, for example, how much of that radioactive compound did you need to really bind to that thyroid hormone. And then you can see things like, if you measure a lot of radioactivity, because there's a lot of that hormone in that sample. If there's little radioactivity, is because you didn't have enough of that hormone. So that's one thing. Then it's also being used to measure the volume of a compartment. In these cases, radioactive tracers are injected into the patient. And examples of compartment are when people want to measure, let's say, the plasma volume, or what's the total body in the total body water, or what's the exchangeable sodium. And you can also measure time-dependent measurements like red blood cell survival or iron and calcium kinetics. And so this is counting its performance on the whole body. So again, you inject and then you take a detector and you count somehow what's happening inside the patient in terms of radioactivity. And we can count the whole body, or we can then extract a sample, such as a blood or urine sample, and at different time points, and we can keep track of how much radioactivity is in those different samples at different times, and get some idea of what's happening in that metabolism of the patient or physiological process of the patient. Then, and this is kind of the main aspects that we're going to talk about in this course, is nuclear medicine is very useful to generate images of organs, and it's also very useful in therapies. So when we talk about generating images, we talk about like first generation images will be in 2D. We call those planar images. And well, then we adopted what is called tomographic imaging, which we can now generate images in 3D. And for therapy, we can use that radiation that comes from different radioisotopes to actually inject them in a patient. We hope and then they go into, let's say, tumors, and that radiation will hopefully destroy those cancer cells, and we will be able to either cure the patient or at least increase their quality of life. So why is nuclear medicine called nuclear? And it comes because we have a medicine that can be called a pharmaceutical. We attach it to a small quantity. We attach a small quantity of radioactive material to that medicine, which is a radioisotope. And this is why we create a radiopharmaceutical. And this radioisotope, as we'll discuss as we go by, comes from the nucleus. Well, those radioactivities, what we're really interested in is in the emissions that come from the nucleus of the atom. So that's where it comes from. Nuclear medicine, that involves radiation. It involves pharmaceuticals. So, well, I'll get to that in a moment. To put some numbers out there, worldwide, about 35 million nuclear medicine exams are performed every year. 35 million is basically the population of Canada. It's like if every person in Canada would get a nuclear medicine procedure. Well, as I said, it's used for diagnostic and therapy. Therapy accounts for around 15%, and diagnostic accounts for about 85%, in which imaging is 75% of that 85%, and non-imaging procedures is about 10%. So
if I may add a comment, if you could go back, Carlos, in our lecture on chapter 5, we're going to talk to you a lot more about therapy, because there's a whole revolution in therapeutic nuclear medicine. So there's a lot of excitement happening there, because typically people think of nuclear medicine mostly as diagnostics, but there's a lot of exciting stuff happening. So we're going to talk about that in the lecture around chapter 5. By the way, chapter 5 is the only chapter in the book that is really not a physics chapter. It's more about, sort of the medical components of it, but it's very important that we all sort of understand that well. We'll go over that later. Just sorry to interrupt, Carlos.
Yeah, no, so exactly. So although this is 15% of procedures right now, we're hoping to see a big increase in those therapy procedures in the coming years. And Armand will talk about that later in a lecture. So, okay, so a radiopharmaceutical is basically that link between the physics, which is everything related to radioactive decay, and the biochemistry, which is everything regarding to, we want to create molecules that when we inject it into the patient, they bind to something specific. So for example, when we talk about cancer, we want molecules that attach to cancer tumors, to cancer cells. But if we want to be able to see them, or we want to be able to treat that cancer, it just, that molecule is not enough. We have to somehow attach this radiation to that molecule so that when it goes into the tumor, it does something there. Either allows us to image it or it allows us to treat it. Yeah, so when we inject this inside the patient, it has a spatial temporal distribution. And that's why, I mean, hopefully it goes into this type of cells that we want. And that distribution depends on those biochemical properties of the tracer. It is not depending on the fact that it's radioactive, it's on that biochemistry. So for example, if we talk about glucose, you know, every cell in the body needs glucose to stay alive. So if we take a molecule that looks like glucose, and let's say we put a radio tracer that will allow us to image, well, if you have necrotic cells somewhere inside the body, then those cells won't take glucose. So we'll be able to see a spot in which there's a spot that is not contributing to the image. So we'll know that that part of the body has some necrotic cells, or it can allow us to show tissue function. So to keep in mind here, nuclear medicine falls under the category of functional imaging. So it does not really show the anatomy or structure. It just shows us the physiology or how the organism is working. It involves some processes there, not really the anatomy. So this link between biochemistry and physics, this is more or less how it looks. Let me just grab a pen for a moment. So what you see here on the left is, we'll understand this better as we go on the lectures, but these are radioisotopes that have some characteristics. You can use some for what we call PET, some for what we call, some for therapy. And what you see on the right are examples of molecules that the chemists, the biochemists have developed. So for example, you have small molecules such as deoxyglucose. So this is a molecule that copies what glucose does. So if we, for example, try to attach, if we attach F18 to that deoxyglucose, then we'll be able to use PET to see where that molecule goes inside the body. Maybe we want to deal with another molecule that is more specific. For example, this one is to binds very well to prostate cancer cells. So if we attach F18 to that molecule, then we'll be able to image those prostate cancer cells. But not everything works very smooth. Maybe if I want to attach an F18 to this other molecule, maybe there's something in the chemistry that doesn't really allow it. So that's the job of the chemist. So maybe in that case, I don't know, it can probably be something like this. I'm gonna try to first image and then change the isotope for one to treat those same prostate cancer cells. So this is the game in which we need to try to play with our tools of radioisotopes and our tools of molecules and try to pair them one to the other to basically reach the purpose that we want, either to image a particular disease or treat it. So in the world, in many disciplines, we have different imaging methods using different types of particles or different fields, different waves, and these are all just examples of those. What we use in nuclear medicine, we're particularly interested in gamma rays. That's what we're gonna really be using in nuclear medicine to generate our images. But then, okay, so we've been talking about chemistry, we've been talking the word medicine, because of course it involves disease, but this is a physics course. So what exactly is the role of physics in nuclear medicine? And well, the underlying physics is really not changing. Like, we know about radioactive decay for a long time, and radioactive decay has been the same for a long time. It's not really changing, but the technology for different aspects of nuclear medicine is changing. So for example, production of radioisotopes. So we work closely with the radiochemists, but there's a lot of physics involved in how do we produce radioisotopes? How do we obtain images of those tracer distributions after we inject them in the patient? We're trying to improve the methods for accurately quantifying what's the concentration of radioactivity inside the patient. So what I mean with that is we're always looking at methods to just not get an image that just shows something, but we want an image that when you go and measure something in that image, it has a physical representation, it has a true meaning to a physical process, such as, okay, how much radioactivity is located in that place at that particular time. We're trying to improve the models used for radiation dosimetry, and we'll get to that in a different lecture, but we want to see if, okay, radiation causes some effects in the cells, so we want to try to deliver as much radiation as possible to treat tumors, but we also don't want to kill healthy organs. So that's what we call dosimetry, trying to do those measurements. Now, physics plays a big role in providing high quality, cost-effective, quantitative, reliable, and biological safe assays in nuclear medicine. For the future, multimodality imaging, in which different parameters from hybrid imaging devices are combined. So, for example, we started talking about PET and SPECT, but now people bring computer tomography, and now every camera that is out there typically is a PET CT or a SPECT CT. There are two different modalities, or there's also another imaging modality that's called MRI. So as we're going into the future, we're trying to combine more and more parameters from different imaging devices, from different modalities, We're trying to make what's called parametric images, and we're trying to combine all this information to better assess a disease. We want to better define radionuclide therapy procedures, having a better understanding of the radiobiology at low flux rates, because that's the type of flux rates that we see in nuclear medicine. We've worked with a gamma camera, and we'll understand because we're going to build a gamma camera as we move through the lectures, but gamma camera is the most common used device to obtain images in nuclear medicine. It's been out there for many, many years. We think it probably needs a little bit of a makeover, and there's a lot of research going on in alternatives that would create better images, better quantitation. One of those examples is something called Compton camera that is, it exists in the lab, but it hasn't really made it to the clinical environment. And then there's also a lot of artificial intelligence. We're trying to bring all these new technologies, all these new methods. We're gathering a lot of new information that we're trying to combine to predict the outcome of diseases, to better diagnose a disease, to combine what we see in nuclear medicine with, let's say, information from the genome to give the physicians better tools to make better decisions. So with all these, nuclear medicine can help in, for example, determining if an organ is functioning well. It helps us identify the physiology and metabolism if they have been altered. It helps in drug development, not just radiopharmaceutical development, but drug development. Drugs typically work by, when you take a drug, it goes into certain receptors of some cells in the body. So with radiation and nuclear medicine, researchers are able to track and make sure that those drugs are going to what they want to go, but then they don't really have to be radioactive. It also helps in reporting, for example, gene expression. Genes are there in the cells. What they do is that they have the instruction to create proteins. So we can use radiation to see if we can measure those proteins. And then if that protein is there, then we know that that gene that creates that protein is there. So that's what I mean with it. And it has many, many more applications. And it spans a lot of multiple disciplines or subdisciplines in medicine. It's used in oncology for cancer. We diagnose and treat cancer. Is used in the nervous system, in the endocrine system, and well, basically every system has an application to measure different things. So this is gonna be my first poll. So just to check how we're doing with the understanding. So let's see. Launch polling. Yeah, okay. So what type of particles and waves are the ones that we use in nuclear medicine to create images? I'll give you guys, we have 22 answers. Okay, let's get
Yes, please feel free to enter your answer, even if you're not exactly sure, because it helps us.
Yeah, this is completely anonymous.
It's anonymous, allows us to understand better what your level of understanding is. So, don't shy away.
Okay, so I'm gonna stop the poll there and I'm gonna share the results. So as you see, well, most people agree that we use gamma rays. We're gonna understand exactly what gamma rays are. We're gonna understand exactly where they come from. But yeah, these are the ones that we do use. Yes. So this is the answer. Ultrasound is another imaging modality. So now we don't use that in nuclear medicine. We don't use biomagnetic fields and visible light. Yeah, we don't use that here. And we talked a little bit about this. So what are the typical percentages for nuclear medicine imaging and therapeutic procedures right now? Now let's give only like another 10 seconds, people to jump in. Okay, I'm gonna stop these very soon. I think this is very clear. Everybody understands. Yeah, we talked about it with Arman.
It's
Yeah,
great.
85% imaging and 15% therapeutic. Sorry, Arman, you were saying something?
That was great. Most people got it right, so that's good.
And this is a true or false poll. So, oh God, no, sorry, this is not the one. Sorry, I'm learning about this as well. So, all nuclear medicine procedures involve the injection of radiopharmaceuticals to patients. Is that true or false? Okay, so I'm gonna stop it now. This one is interesting. So let's share the results. So most people say it's false, but a lot of people also say it's true. So no, so let's keep in mind, there are procedures in which we call this nuclear medicine. We use radioactivity, we use blood samples, but the radioactivity doesn't necessarily always have to go into the patient. So no, nuclear medicine procedures don't always involve the injection of radioactivity into patients. We can first extract a sample from the patient and then mix it with radioactivity in the laboratory without actually delivering to the patient. Okay, and then this one is a little bit to think more about. Okay, from what I discussed a moment ago, what do you expect to see in a nuclear medicine image? Would it be a very sharp image of soft tissue and bones, or a blurred image of the liver with a dark spleen, but not too much details of the organs? You would see tumors with very well-defined edges. It will be A and B. Okay. 5 more seconds, and I'm gonna stop it now. So, okay, it looks like people mostly say A and B. So, okay, let's see, because A says a very sharp image of soft tissue and bone. So that's giving us a lot of information about the anatomy. You will be able to see this is a liver, this is a kidney, this is very well-defined bone. But as I just said a moment ago, nuclear medicine falls under the category of functional imaging. It provides some information about the metabolism, the physiology, but it doesn't really show us too much of the anatomy. So you would expect something more like a blurred image of the liver with a dark spot in the middle, but in many cases you wouldn't really see much of other organs, depends on the radiopharmaceutical. You would definitely be able to catch the tumors, but as you will see as we go through the lectures, because we don't really see the anatomy of the tumor, is more those edges are not necessarily very well defined. You don't really know where it stops being a tumor and where it starts being some other organ. So the correct answer here is a blurred image of the liver. Keep in mind, is functional imaging, is not really an anatomical imaging. When we see anatomical information is when we combine, let's say, our nuclear medicine modalities with an anatomical modality like MRI or computed tomography, then we can overlay what we see in nuclear medicine with what the information that we get from their anatomy, and that's why we're able to correlate anatomy with functional information. But no, nuclear medicine imaging itself, you wouldn't really expect to see very, very detailed anatomy. Is this clear? Does anyone have a question about this? Okay, there's a question in the chat. I see, are radioactive binding acids being used today, or have they been replaced with other non-radioactive techniques? That's a good question. Well, to answer really straightforward is yes, radioactive binding acids are still being used. They're very, very used, especially in radiopharmaceutical development. When we really need to see, for example, how much of this drug needs to be injected into a patient. So you need to see how much is the binding to the target that you are trying to measure. That doesn't mean that there's not other techniques to do that. There's some other methods of doing that use fluorescence. In that case, it would be using visible light, but then that's another field that is not nuclear medicine. So there are other modalities. It doesn't, but binding acids are very, very commonly used still today. Someone is asking, why is this focus on the liver? No, this is not necessarily just focus on the liver. This was just an example. I mean, I just thought that an example of a blurred image of the liver with a dark spot would be an example of maybe some cancer metastasis in the liver, but no, it can apply for many other organs as well. This was just a quick example.
In other words, you may see such a thing, but you don't have to see such a thing.
Exactly, yeah. So, okay. So that being said, that was the introduction to nuclear medicine.